Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Today we're answering a critical question many families have: how long can a patient stay at a select specialty hospital? This is a major concern when a loved one is seriously ill and needs more care than a traditional hospital can provide. First, it's important to understand what these hospitals are. Select specialty hospitals are known as Long-Term Acute Care hospitals, or LTACs. They specialize in treating patients with complex medical needs, like those who need to be weaned off a ventilator, have severe wounds that aren't healing, or are battling multi-system organ failure. The simple answer to how long a patient can stay is this: there is no set time limit. The length of stay is completely unique to each patient and is based on their specific medical needs and progress. The average stay in an LTAC like select specialty is typically around 25 to 30 days, but this is just an average. Some patients may recover more quickly and be ready for discharge in 2 weeks, while others with very severe and complicated conditions could stay for 2 months or even longer. The deciding factor is always medical necessity. As long as a patient requires daily physician supervision and the intense level of care that only a hospital can provide, their stay is justified. Several key things influence the duration. The primary factor is the patient's medical condition and their treatment plan. For example, a patient learning to breathe on their own after being on a ventilator has a very specific, goal-oriented treatment plan. Their stay will be determined by how they progress toward that goal. Another major factor is insurance. For patients covered by Medicare, the 25-day average is a guideline that helps define what an LTAC is, not a strict cap on a patient's stay. Medicare and private insurance companies will regularly review the patient's case with the hospital's care team. These reviews ensure the patient is still benefiting from the hospital's services and that the care is medically necessary. The hospital's case managers work tirelessly to provide updates and documentation to the insurance provider to get continued stays authorized. The goal of a select specialty hospital is not to be a permanent home, it's to help patients recover and become stable enough to move to the next level of care. This could be an inpatient rehabilitation facility, a skilled nursing facility, or for some, directly back home with home health services. Discharge planning begins almost as soon as the patient is admitted, so the family and the care team are always working together to prepare for a safe and successful transition. So, in summary, a patient stays at a select specialty hospital for as long as they medically need to. It's a dynamic process based on their illness, their progress, and their insurance coverage, with the ultimate goal of getting them to a place of greater health and independence. I hope this explanation provides some clarity on a complicated topic. If you found this video helpful, please hit the like button and consider subscribing to the channel for more straightforward answers to your healthcare questions. Thank you so much for watching.